بسم الله الرحمن الرحيم
بسم الله الرحمن الرحيم الحمد لله رب العالمين اللهم صل على سيدنا محمد وعلى آله وصحبه. We are going to start and our doctor is going to read some of these principles that are written there.
Bismillah ar-Rahman ar-Rahim. So the way we're going to do this session, inshallah, is to go through some of these scenarios. Some of them are probably repeats of the previous ones as well. And I'm going to ask the Shaykh if he could also use some of the principles that we've spoken about and try and bring them into the explanations for the justifications behind the things that we talk about. So firstly, inshallah, we'd like to ask you about the role of a do not attempt resuscitation order in Islam. So this is, if you want me to clarify that first.
Okay. Bismillah ar-Rahman ar-Rahim. Allahumma salli ala alhamdulillahi rabbil alameen. Allahumma salli ala Sayyidina Muhammad wa ala alihi wa sahbihi. Here in this one I feel easy to answer it, because the scholars, they subdivide the treatment per se to three categories. When it's definite and sure, it's an obligation. When it's for sure the possibility of it less than 50%, it's not recommended. If it's above 50% but it's not sure, here it's highly recommended, but the patient has the decision to say yes or no. Let me add on it, correct me if I'm wrong. Here in UK and in US, economy play a main factor there, which worry me a lot. Okay, I highlighted وما خلقت الجن والإنس إلا ليعبدون. I highlighted خيركم من طال عمره وحسن عمله, just to, and I highlighted also again that in the Muslim rules you have the priority of the self over money. Okay, just to highlight these matters, So basically, when the resuscitation is an obligation, when it's going to survive the life, as I experienced when I was in US, someone has a complete heart stop, and he was resuscitated and he returned back to life. And I don't know for how many years it is. So in this trial, I look at it as a must. When medically they said he is brain dead, and correct me if I'm wrong, if he is brain dead, confidentially, that's mean it's 0% to survive, and by this, for sure, you don't resuscitate, okay? Whereas the others, here you have the largest room of it, and you are going to have a lot of controversy. But I'm trying to say, don't make the economical decision dictate on you. And this is perhaps more problematic, of the developing countries. You have limited number of ventilators. You have limited number of artificial kidneys, okay? If they are used for someone, perhaps you are blocking someone who is much more important, life-wise, okay? Whereas here, since everyone entitled to be treated, I think the government is interested in cutting down, the medical expenses all the time. And in US, when I used to be there, the insurance companies, it was the expenses, they were growing, massively, like explosion. And if you want me to speak about the whole problem, I'm going to speak about it, even though I may not have the good answer to it, because it's all built in banking system and interest, and Allah subhanahu wa ta'ala said, يَمْحَقُ اللَّهُ الرِّبَى. Okay, and this is not going to have any barakah there, and we are going to have this problem in US, is going to expand more and more. Why? Because it's all built on the insurance companies that they are related to the banking system. Okay, so if it's not governed by these two matters here in UK or in US, this is my answer is going to be that whenever it's definite or possible or it's 0%.
Okay, I think this goes on to the next question. So, deciding not to treat when it is deemed it will not improve a patient's quality of life when they are seriously unwell. So maybe a patient is already on treatment, but you decide that you're not going to increase their treatment in any way.
Again, please, if you permit me, quality of life. Okay, I may differ with the definition of quality of life which looked at here. The quality of life here, to be good, and be in your society, have some involvement of whatever of this, Whereas as Muslim, the quality of life to be good worshipper of Allah subhanahu wa ta'ala and have good deeds. Okay, so here, again, I have nothing against this rule here, but I would to just be aware that the definition of quality of life, we may differ about it.
So, can a Muslim have an advanced decision not to accept treatment? For example, somebody who is actually well decides that later on in their life, if they would become unwell in any way, that they would want to refuse treatment, especially if they were unconscious at the time that they became unwell. Could they make a decision in advance to refuse or accept treatment?
Good question. To best of my knowledge, he may give a suggestion, but at that time, his guardian, the one who is responsible to give the decision about it. Okay, and here he may give a suggestion or whatever. Then, when something happened to that person, the decision is going to be made by his guardian. And this is just sorry, by way, really, when you look at the inheritance law in Islam, give you all steps, of the guardians and the relation and the responsibility and you name it.
I think that differs from the British, the UK law, where you can have a advanced decision to refuse treatment.
I think so.
But as a Muslim, would you suggest?
This is a suggestion. I may give suggestion to my children. Let's say, if I went to ventilation, don't do anything for me, okay? But then the decision is going to be made by them, not by me, if I'm unconscious.
Okay. And then, so one of the pertinent questions of this evening.
Let me also, sorry, here. Sorry, perhaps I did not prepare. And here you have something, it's called "Let's Go." Okay, and some they may commit suicide or whatever. This is not the Islamic look to it. Okay, it's not my decision to say "Let go." Okay, and these are prohibited, Islamically, and that's why. All of you will believe, I think, in Malak al-Maut, okay? And there's someone else, to handle those matters, It's not up to me, okay? Many of us, inshallah not of you, they may like to end their life, but this is not their choice, And the other, they may like to have longer life. Again, this is not their choice.
Inshallah, so quite pertinent to this evening was this question about withdrawing treatment.
Okay.
So, for instance, a patient, and one of these questions actually relates to that, is somebody who is very unwell in a intensive care situation, and the doctors are suggesting that the treatment should be withdrawn because there is no chance of survival. What is the Islamic point of view on that, and how should the family go about making that decision?
Okay, with all consideration that I've mentioned, I think you gave the answer. If the physician said that there's no chance of survival, it's okay. But here, I look at it from two aspects, from the passive one and the active one. Switch off the machine, I'm not going to do it. Stop treatment, I may do it, okay? Namely, I may not change the IV, okay? I may not give him his medicine, the support of his blood pressure or this or that. This is going to be looked at as a passive thing, not active thing. When we switch off the machine, you have active matter. This is, for the surprise of some of you, this has been discussed Islamically. They spoke about the person who was badly wounded and about to die. This may be not the same case. And here you may have moments, you may have hours, and he's going to die because of the undeveloped, measurements of these days, If someone killed him at that point, this has been discussed. He is not killer. He's not going to be looked at as a killer, but on the same time, he has responsibility and he is a sinner. Okay, that's why my answer is going to be for withdrawal, to be in the passive side, not in the active side. And medically, correct me if I'm wrong, those who are branded, they are not going to last, they are going to die eventually. Perhaps it takes 2 or 3 hours more, and they are going to die, Whereas to switch off the machine, this is active action that I have some concern about it, that may be included, as I said about that one who was badly wounded, and someone killed him. Here, again, you got yourself involved in this. For sure, perhaps there's no law punishment of it, but Islamically you may be interrogated about it, because this is, you have an action. And I might, if you give me permission, and I might enlighten this, by something, mentions the law, and mention Islamically among all madhabs except madhab al-Maliki. They told us in US, if you pass through a person, I think the law here is the same, A person who's about to die and you are a physician and you do not get yourself involved in his treatment, you are not responsible as a law, okay? But when you start treating him, you are responsible for any negligence or whatever. And this is the opinion of 3 of the 4 madhabs, namely Hanafi, Shafi'i and Hanbali. Whereas in Maliki, they look at it, quitting is similar to action. Okay? And here, the thing I spoke about passive and active, or by the other one about that law, it may not be applicable for the Maliki method.
And that takes us on to the next part, is if a family is put in that situation where clinical staff are saying that we have no option but to switch off the ventilator, what approach would you suggest, or how would you guide the family to go about dealing with that decision? Is it in their hands, or is it out? They just accept that it's out of their hands and it's a medical decision?
I look at it that it is in their hands, because if the person still conscious, it's going to be his decision, When you have anything which take his decision of being considered, the second one is going to be the decision of the family. Again, I have little bit hesitance, about the way the medicine practice here in UK and US regarding the economic points that I highlighted.
And again, following on to the next part, is there an obligation on Muslims to preserve life as much as possible, even if it is futile on the advice of the medical profession? So if there's no
as I said, there's no obligation, as I said before, Even for the high possibility, there's no obligation of treating yourself, But again, just put in your mind the other factors that I mentioned. No obligation.
A question we've had from the audience is someone who is in a persistent vegetative state. Would you say that their soul or their ruh has left them?
Again, I'm going to say, if I said yes or no, don't believe me. Okay. Why you ask this question? We are here as human, limited to the physical matters. Many of those non-physical, we are not familiar with. Being physician, even myself, I haven't studied anything about ruh. I know, I'm going to tell you about this story. I know about famous Shaykh who left a book, of 4 volumes speaking about ruh, which is not available to me. I would like to have it available for me to try to educate myself, about ruh. Here, this question, if it's for the medical view of it, I don't think it makes any difference, okay? Yani here, it's related to the medical judgment of that person. No. Don't speak about soul because I don't know, okay? This is not my task, to be asked, about the non-physical or the spiritual matter of that person. I am here as a physician, or when I speak from fiqh-wise, I'm going to speak about the physical matters that are seen to me, and Allah subhanahu wa ta'ala obliged me to go by these measurements. I'm not going to make my decision according to something spiritual or whatever in this regard. I put it in consideration, but here to say the ruh is there or not, and I may correct the question of vegetation stage is not similar to brain death. I'll give you this story, when I was in Riyadh City, it happened also. Perhaps this is too rare. I have only this case, that happened, A person was admitted, with a complete coma, and all of those reactions were negative. Then they figure out to have EEG for him, and they have some waves there. And they kept him. Perhaps if you are pushing, you may, but this is again against the regulation of brain dead. And here when you have some activity in the EEG, that means he is not brain dead, okay? And they kept him, and after 21 days, he returned back as a normal individual. He has Guillain-Barré, which started, from feet, and this goes all the way up to the connection between the brain, which is unusual case, to the connection between the brain and all the surrounding. And all of these surroundings, they were not working. They are in what we may call the sleeping state, and the brain was working alone, without anything, And they asked him, he said, I was sleeping, that's what I felt, And he returned completely as a normal person. So here, I would like to give the difference between the vegetative state, and the brain death. They are not the same.
And actually, that is a question from the audience again: is brainstem death accepted as an Islamic definition of death?
This is again, this is not as I said, this to the best of my knowledge doesn't contradict with the base or the essentials of Islam. Okay, but again, I'm going to look at it passively, not actively.
So if a specialist decided that a patient was brainstem dead, in that situation, would it be acceptable to switch off the
No. Again, I'll go by the passive way, not the active. Okay, even here, I think this our look, in the sophisticated countries, like UK and US, we are going to be 100%. That's our assumption. I may be wrong, right, about your diagnosis of brain death, But in other countries, it's not as such. That's why this answer is not for everyone.
So, are you saying that the definition of death is actual heart stopping?
This is not our business as physician or as fuqaha, okay? This is a matter, may some of us know about it, and it's Allah matter, okay? So, but here, I think regardless, if he is dead or not, if the soul is there or not, I'm going to do my duty. I'm going to fulfill my duty in this regard. And it's very easy for me because, as I said before, whenever medically they said the possibility is way down, let's say 10%, or in the brain death it's 0%, I have very free life of not treating that patient, okay? But to be active, again, I have some problem about it.
Is any life better than no life, even if the patient is in pain and discomfort?
Again, we highlighted the physical matter, pain and physical discomfort, okay? Here, I think this is not exactly the look Islamically to the life, okay? The life Islamically is to worship Allah subhanahu wa ta'ala and have good deeds, And this is maybe practiced with pain, and discomfort. Up till now, to best of my knowledge, in most countries, you don't have it in the active way. But I have some concern that later on, it may happen, that they will kill the crazy person or the one who has Down syndrome or the one that they consider that economically we are going to spend a lot of money on him or this or that. I have a lot of concern about this point, okay? That's why I would like all of us, be well-oriented about the target, the aim of this life according to Islam view and not. And I think this is quite helpful to look at the 5 major items in your life. I'm going to mention them again: religion, life, intellect, money, and fame.
I think this ties in with another question: is can you say something along the line regarding euthanasia, and how do you distinguish between withdrawal of treatment and euthanasia?
What is euthanasia?
So euthanasia is actively helping somebody die because somebody wants to assisted suicide.
This is, to the best of my knowledge, is prohibited to be done. Okay, to be passive in the old laws in the US, in Mecca and elsewhere, and fiqh-wise, they are well established that this is permitted to be done passively. But to be done actively, I have a lot of concern about it, and by itself, I have a lot of concern, and to be expanded in the future, when we got more materialistic, again, I'm going to have a lot of concern about it. So I disagree with it completely. And I don't see a major difference between the 2 choices when you have someone, his possibility of survival is less than 10% or less.
I think there was a question on how do you decide on percentages. I think would you say that was more for a medical person to try and suggest that to the family, the patient?
That's right. I think for the percentage, the best one is to decide about it is the physician himself, okay? And this is, you may take it from the Qur'an, فَاسْأَلُوا أَهْلَ الذِّكْرِ إِن كُنتُمْ لَا تَعْلَمُونَ. I don't know if I'm an ordinary patient, I may not know about my case, So then I should ask the physician, about it. And he's the one who is decision maker. Sometimes they may have more than one physician to have this decision.
And somebody's asked, they've given an example of a case. So an 85-year-old gentleman with many comorbidities has chronic kidney disease and needs dialysis. He does not want to put himself through that. Can he reject treatment if it means a shorter life?
Again, here I look at treatment for, let's say, acute infection, which I look at the modern medicine as very good at it, For acute infection, I don't see it's an excuse, and he should be treated, for it. Because, correct me if I'm wrong, with the antibiotics that we have, we are, in most cases, we are successful in treating these matters. And Ibn Arabi, he said, the high probability here in medicine is equal to definitive, when you are definite or certainty, okay? Whereas, when you are speaking about some chronic disease which has been going on for a long time and there's no significant improvement, I'm going to agree with you that this person may have the decision to say, I don't want to go, and namely like chemotherapy or whatever of that regard. Okay, so here to say treatment per se, I don't look at it as a precise, okay? It should be subdivided to definite or certain, or what is close to certain, and high possibility and low possibility.
The questions are coming in thick and thin, so I'm trying to sort them out into categories, but we'll just take one just to try and change the subject.
If you want to repeat them, perhaps this will clarify many points, because this is, I think, I was brought only for that problem. This is the major problem that we have nowadays, okay? But anyway, feel free, you are the moderator of that.
Is it permissible as a doctor to put someone on the end-of-life care pathway? And that's a pathway we have in the UK where we decide not to treat them further, decide not to give them any more IV access if their IV access
Okay.
comes out?
Should be decided according to the estimation of the case of the patient, in what category. Okay? And again, I think the same patient, he may have a problem that is easily treated, and another problem is complicated, and most probably is not going to be successful. All those matters should be put under consideration.
A couple of questions here, one on autopsy, and is autopsy allowed in Islam?
To start with, no. Then, if it's needed medically, there's a statement mentioned by the fuqaha, to survive the alive, it's much better to keep the dead diseased body as it. Okay. By this, you may have some consideration to this. But this, I look at it as a necessity, and I'm going to go by the least possible practice of it. Okay. I was in medical school in Damascus, and those lousy doctors, they misbehave with these bodies, and they have many bad practice, get picture with some of those dead women, or this or that, which is, for me, that's why, even if it's permitted, should be to the least needed way of it, not to go beyond it at all.
I think another question similar to the previous one before was if a patient has cancer, can they refuse chemotherapy and radiotherapy? I think you've already answered that question.
Yes, you have some of those cancers, they have the gut now to say that it's a cure, and some of those blood cancers, and this, I think, they may fit the criteria of being, high probability or certainty, whereas other, they are not as such, and that's why we should have the estimation come from the expert physician on this.
We have an interesting question here. Were there ever any of the Sahaba who were in a coma at any point in their lives?
Good question. Be knocked out, or passed out. You have Sayyidina Jabir, you have many other companions, they have it, But to be in coma, I think in these old days, he will be gone away, easily, within 1 day or 2 days. It's not going to take long time, They were not that skilled, in putting nutrition and fluids for him, through whatever is going there. So, the answer to this question is, I don't know, most probably no, but I know about a companion who died completely and spoke after death. His name is Zayd ibn Jariyah.
SubhanAllah. There's a question here, or a statement from the audience. I came across a farm in Kuwait which was treating cancer patients by camel milk and urine. What are your views on this? Should we just be sticking to medicine as we know it from a Western point of view, or actually, what are the ethics behind seeking alternative medicine?
I'm not expert in it, I'm sorry. My specialty was in the modern medicine, which is the Western one, not the alternative one, But what I hear, perhaps you hear about it, much more than me, Some of them, they may be successful sometimes. Many of them, they are not that successful. So I have no idea.
So even if, I suppose it's down to the patient to decide whether they accept it as a treatment or not.
That's right. Since the possibility is low, in my idea at least, then I give the decision to the patient himself to decide about it.
I've got a question here on cremation forms. So are doctors allowed to fill out and sign a cremation form whereby they are identifying the patient and identifying the causes of death of that patient, and then signing a form that would then allow that patient to...
Question that I had to answer, up till now I don't have definite answer about it. I keep thinking about it. For Muslim, for sure, it's prohibited because there's fard obligation, fard kifaya, to wash, to put him in sheet, and to bury him, or him. For the non-Muslim, to be honest with you, I haven't get in this involvement, but I look at it, correct me if I'm wrong, The filling of the form, and signature is not the main factor of burning that body. It's just to make it legal. And by this way, I look at it, and here the physician, he is not the one who gave the permission, he is not the one who burned the body, he just make the other factors that help this procedure make it available. So I may answer it, I don't know how accurate my reply is going. I have a lot of concern, I still think about it, because the Prophet ﷺ, when he passed through anybody, he will not ask if he is Muslim or non-Muslim, is going to bury that body. Okay, so that's why I have some concern here. So here, I look at it from the Hanafi viewpoint, it may be makruh tanzihi, which is no sin. For the other mazhabs, since you are involved by one way or another in making that burn, okay, it is haram, okay. So for the other mazhab, it's haram. And Hanafi, it may be a little bit easy, by saying it's makruh tanzihi, not more than this. Again, I have a doubt about my question. I'm not quite sure, and this is one of the toughest question. I keep asking myself about it. And some other they keep asking me about it, and I'm not quite sure.
There is a part of Islamic law that deals with society and making sure there's resources for the whole society, not just one individual. What is that area of Islamic law which deals with the allocation of resources? In the West we might call it distributive justice. And for example, should significant cost be spent on a patient who is 10 years old or the one who is 100 years old? And I think we've kind of answered this with the Islamic.
I may add, we as Muslims, at least in my view, we are in real need on what I have said before Maghrib prayer, about having committee, of shuyukh and experienced people, for the medical and economical matters, of this life, which has been changed dramatically for the last 100 years. Okay, and I look at this from the economical side, and we need some answers, for this problem.
Okay, I think one last question. We have to take a short 5-minute break.
Okay.
It's got to 9 o'clock, mashallah, very quickly. How should we practice in this land where the law is that the patient may have to have an autopsy after death? Obviously, we have to follow the law of the land, but also we're also in an obligation where if the doctor says that we need to switch off ventilators, we as family have to accept that decision, or should we be fighting through it in courts and trying as much as we can with our resources to fight that decision?
To be honest with you, I just heard, about a person killed, 2 weeks ago in London, or 1 week ago, and they made an autopsy, and the reply was that is a pillow to the here, for that Muslim person, I don't see any importance of making autopsy for such a case, because it's quite obvious. And I think as Muslims, we should speak up in our rights, not to have autopsy forever. But to be honest with you, we as Muslims are bad practitioners, because many of the Muslims who live in this country, they put in their wasiyah, please take me back to my country when I die. And this will not be made, correct me if I'm wrong, because I was in Riyadh City and they told me this is the international law. You cannot move the body without having, some empty belly, of all of those intestine and others, things, which shouldn't be done. That's what I told my colleague. If I died here and you can bury me here, don't move me, don't take me to elsewhere. So since we practice it ourselves, knowing it or not knowing it, it's not going to make a lot of sense, to tell them I don't want to have an autopsy. We should firstly be firm about this point, okay? You enjoy your living here, then die here and be buried here. No point, of trying to go over, the Islamic law, Islamic regulation, just to be buried in your homeland, or whatever. For me, it doesn't make any sense. I don't know, perhaps the other, they may have different feeling. So let's start practicing it in ourselves, and then we should have significant standpoint, and I think the government here, they may understand that this is against Muslim regulation, and they may have some solution for it. Some cases it may need, autopsy, and this is may looked at as a necessity or highly needed, then you may have it, But for that case, that I told you about, when they told me in the news that this is what they said, and they found a bullet, and that's it, Yani that's mean no benefit is gotten at all, from that autopsy, and this is my main concern about it.
I think we would take a 5-minute break and then 2-minute break.
Yeah, if you're a medical doctor and a qari and a scholar, you may leave the room. Otherwise, you stay here, please. That's only you, Sayyidi. 3-minute break, inshallah. Because we want to keep
I am Dr. Sayyidi.
Just 3 minutes, because we don't want to break the session. It's just to give the Shaykh a break, inshallah. 3 minutes, inshallah.